On April 18, 2016, some parts of Cy-Fair community in northwest Harris County got as much as 17 inches of rain within 12 hours.
We had a lot of water coming in our house, and concurrently with that, the power was going off and on. And then shortly after the flood began and got up into the front yard, the sewer system quit working. So
hundreds of houses and apartments flooded. Many residents had to be rescued.
The day it occurred, it was totally unexpected. So therefore it created a lot of feelings. Therefore I didn't know exactly what to think, what to do, what to grab, what decision to make.
This ghost line right here, this is the water level. This is where the water level stops, right here on the mailbox. That's half the size of this box. See that line? It's going right across here. See? See right there? That's how high the water.
A month after the flood, Harris County Public Health did a scientific survey called a Casper. We set up a command center in the community and sent over 20 survey teams into the Cy-Fair neighborhoods to talk and walk with the residents.
Copies of important documents in a safe, waterproof place.
yes.
Written content information.
The
from legal
Casper,
providers.
Community Assessment for Public Health Emergency Response, is a scientific survey method developed by the Centers for Disease Control and Prevention. It provides a snapshot of household-based information about a community. In this case, we wanted to know what the community's public health needs were after the floods and assess future needs so our health department and residents can be better prepared and more resilient.
Everything you see was like floating in the water. It was like floating in the water. I lost a lot of tubes in here.
In the incident command post, we managed the operations out of the field. We wanted to make sure our volunteers and staff were safe in the field. We were also getting updates from our teams on the number of completed surveys. In this instance, we needed 168 completed surveys to be statistically significant.
So today the teams will be knocking on doors in certain areas and carrying out a survey, asking the residents were they impacted by the flood and what resources that they are in need of, and also were they prepared.
Our survey teams were comprised of staff, volunteers, students from universities, other agencies, and ham radio operators.
What we are doing is providing communication between the command center here at on Telge out to each of the field teams as they are doing these surveys for the county.
Some of the questions are asking about food supplies, anybody have medical conditions, or need any assistance going to hospitals or medical services, were they out of electricity?
What about, did you hear anything about food safety, about when to throw out your food?
You know what, if it wasn't a 5-day supply, we had food.
In the refrigerator.
Right, it was food that was already in the refrigerator, but it wasn't anything freshly prepared.
Once the data is collected, we're going to take it and have a team analyze that information, and what the findings are, they're going to move that forward to local and state officials to see how we can better prepare for the community for our next disaster.
I volunteered because this is one of the areas that I normally patrol, so I am kind of close with this community. And so the residents that I do know, I want to make sure everyone is prepared for not only for themselves, but for also their pets of family as well.
This is the second time that I'm volunteering in Casper because I use my 2 languages to go through the surveys with the community.
So we're going to take this route now exiting to go and change the cluster, right?
Yeah, go down there to the
right
left
or
or right, one of those, I don't know. but we'll either run into a house, make a new pool for somebody. We'll make it work.
In a Casper survey, specific neighborhoods within an area are randomly selected electronically. Some survey teams were assigned to neighborhoods where residents were still struggling to recover.
And a lot of times they didn't even want to fill the survey out, but we said if you could just fill out a few, you don't know how much this is important to the community, not just the community but to yourself, that we could provide these needs for you afterwards.
The first neighborhood that we did a survey on did not have as much damage, and we completed the number of surveys that were required. We went back into the command center and they gave us another neighborhood where the neighborhood was very, very devastated. Every single home had devastation. Every single home had debris.
And I haven't got the kitchen out yet because we still need a place to cook. Yeah. So that's a mess. It's all the mold.
We had people with generators on that were getting gas, and it was very stressful, especially with one instance that we had a family that had 8 children, and they had no water, and they had basically gut out their whole home, and they had a barbecue in the front, and they were cooking, but it was really difficult because they had so many children. When we went out to go do the survey, we were instructed that if we saw somebody that was in dire need of help, we were instructed that when we completed, we would tell the command center who or what areas needed the most help.
We had a debrief with all the survey teams immediately after they returned from the field. When I heard there were people who still were struggling to recover, I called the Harris County Office of Homeland Security and Emergency Management to let them know what we had found.
As we received information from our Casper assessment teams in the field that there was an unmet need for the public and the residents in those areas, we immediately took that information, coordinated it with the appropriate response agencies here within the EOC so that we could address those unmet needs as quickly and effectively as possible.
While the survey takes place in just one day, planning and coordinating with partners is critical to a successful Casper, getting enough surveys for a scientific assessment of a community's preparedness. We have done 2 previous Caspers and spent months planning them, but this was the first following a disaster, and we only had 2 weeks to plan.
To help prepare our survey teams, team leaders drove through their assigned areas. By ground truth, this allows us to spot safety hazards or any barriers we may need to overcome before we start our process.
Ground truthing also provides information for outreach to let residents know in advance about the upcoming survey. Apartment complexes, homeowner associations, and community groups can be informed in person or through email, social media, and news media. Advance notice increases the likelihood residents will participate in the survey.
Training everyone involved in the Casper is extremely important.
The point of the training that we're doing today is to familiarize people with the concepts of Casper and what they should be doing. Everything from the interviews that they'll be doing to how to count the homes to which homes not to go to.
If you come to the house and you recognize that there's Spanish speakers, you can use that script and also a survey that's in Spanish too.
And so we want to give them that information ahead of time. We will give it to them again tomorrow, but if people hear things more than once, they're usually a little more prepared.
This Casper was very successful. We exceeded the required number of surveys, which provided valuable community input. We can't always prevent disasters, but building community resilience means residents will be better at preparing for and recovering from emergencies. But the most important outcome of the Casper was being in the community, letting the residents know we are here to help.
When I went out the first time, water was only up to the street light here, but not this street light, but the next one. That was about 2 o'clock. I think everybody needs to realize that we can't prevent a lot of these incidents, so we have to prepare for them. And that comes through education. I appreciate what your agency is doing as far as helping the community understand what can be done to get ready for disasters, especially those that affect public health. I know you care about people or you wouldn't be out on a Saturday doing this.